Welcome to the Menopause Stories podcast. I'm your host, Dr. Tamara Beckford, founder and medical director of Truly Balanced Wellness Care. This is the space where we stop the guesswork and start the optimization. We're pulling back the curtain on that midlife hijack and giving high achieving women the clinical roadmaps and unfiltered stories they need to reclaim their edge. Let's get into today's story. Real talk, ladies. You've been Googling your symptoms, bringing your labs to your appointments, and still leaving with everything looks fine. It is not fine, and you know it. That is why I created the Hormone Manifesto, a 60-minute course that teaches you exactly what your hormone lab means, what optimal looks like for your body, and the exact questions to ask your provider at your next appointment. 6 modules, a clinical reference guide that you get to keep forever. Available nationwide for just $97. Grab it at go.trulybalancedwc.com/the-hormone-manifesto. Link is also in the show notes. Now back to Menopause Stories. Welcome to Menopause Stories podcast. This is Dr. Tamara Beckford. And you know what? I'm super excited today because I got to bring one of my great friends on who's a dermatologist. Today is all about menopause, perimenopause, and skincare. So I am excited to introduce my guest, Dr. Sarolta Szabo. Alrighty, Dr. Sarolta, go ahead, tell us all about yourself, and I want to hear a little bit about your menopause story. Go ahead and greet us.
Thank you so much, Dr. Beckford. You are such a dear friend of mine, and thank you so much for having me on your podcast. This is such an important topic, and
Yes.
it really comes from my heart to speak to your audience, and the same way I talk to my own patients. So I
Absolutely.
have been a physician for 30 years now, and have been practicing dermatology over 20 years here in Colorado. The practice that I own is called Alta Vista Dermatology. It's now 16 years old, and we are at the south from Denver, in the Littleton, Highlands Ranch area, serving people here with aesthetic dermatology as well as medical surgical dermatology. So it's kind of like a comprehensive practice.
Yes.
More recently, we kind of dove into the wellness space a little bit too, just mostly because I realized over time that it was impossible to practice and even medical without addressing the entire body. And I know
Absolutely.
this is right now, it's a really hot topic. It's all over social media, on the internet, everywhere. But I think it is just really important to realize that in the past, we only addressed as physicians, we
Mhm.
only talked about diseases. Okay.
Right.
So medicine was like, okay, well, you have a sore throat, you have, a certain condition, you go to the
Mhm.
doctor and they'll fix it. But I think we now realize that medicine is a lot more than that.
Yes.
And we want to prepare our patients, our clientele, not just patients, but our clientele to face changes in life. And that
Absolutely.
ties into menopause
Oh, yeah.
perfectly because actually, menopause is not a disease. And half of the population, all of us women, will go through menopause no matter what.
Yeah.
And it's not a disease, it's a condition. Just like when we are pregnant, it's not a disease. It's
Right?
with these changes. And, just as a side note,
Mhm.
men also go through changes in life. It's not called menopause, but they also go through life. And just a quick history
Mhm.
background, if we look at just for fun purposes,
Mhm.
if we look at years ago, so 1826, the life expectancy was around 30 to 40 years all around. So probably nobody knew what the hell menopause was,
Exactly.
you
Yes.
know?
We
And
never got
then,
that far.
no, And just 100 years ago, still most of the world life expectancy was about 30, 40 years, 35. In the United States, actually, the average life expectancy was 59. So
Mhm.
those individuals started to experience some of the changes.
Yes.
And then we get to 2026, where women expected to live on average about until 82, and
Mm.
men expected to live until 76. So more recently, we started to talk about okay, well, now we have a lifespan, a
Mhm.
longer life. We achieve that with many different things, right? Different hygiene, different sanitary things, different vaccinations, and lots of things, antibiotics, medications. But how about health span?
Yes.
And all of a sudden, now we talk about it. I do think women used to silently suffer. Women who actually lived that long
Mhm.
silently suffered with all the symptoms. Now we know that it all is caused by menopause. And then slowly coming out from the darkness, we are talking all the things. And so, in my field, in dermatology, when we look at the skin, okay, there are lots of changes, but you know what?
Mhm.
Actually, there are other changes under the skin, and I cannot fix the skin without fixing everything. And
Mm.
this is why I had to bring in wellness to the clinic, because I think to get the best result for everyone, I have to include other topics into the consultation. Otherwise, my results that I know I can create will be sub,
Right.
because we are not able to do it.
Oh,
But real
wow.
quick,
Mhm.
real quick, I you asked me about my story, and
Yes.
I have to bring you back to the time when I was still having periods, but I broke my leg skiing in 2018,
Mhm.
and basically the problem was that I went to on a street with my oldest son. It was a mom-son trip, and
Mhm.
I broke my leg skiing from a very minute injury. And most normal people would have actually tore their ACL. Most likely, there was a lot of tension in the joint space.
Mhm.
And most people at that point would have tore their ACL because of the tension. But actually, what happened, my ACL was stronger than my bone
Mm.
and pulled out part. The ACL was intact, but pulled
Tore
out
the
part of,
bone.
tore the bone, tore the
Wow.
bone. And so I was devastated. And, I went through a very complex surgery, a very long recovery. I had a phenomenal surgeon. He was really, really good. He did an amazing job. When I went back to see him, I think it was maybe my 3-month follow up after
Mhm.
surgery. And I was already doing pretty good in terms, not fully recovered. It takes about a year, but
Mhm.
I was able to, just kind of walk around without crutches and all this stuff. But I asked him a question, what he thought about getting a bone density scan for me.
Mhm.
And mind you, I wasn't 50 yet.
Mhm.
And he was, he's very, very good surgeon, very skilled. I am so grateful. He gave my life back and I'm able to walk around and everything. But so I asked him, like, what do you think for me to get a bone density? And he's like, if you really would like, we can order one if you're really curious. And I'm like, I just think something is not right here. Bone was weaker than my ligament.
Mhm.
And nobody really asked, but I do have a family history of osteoporosis. And I also had two babies in my 40s. So I just think, I think it would be kind of just for curiosity purposes. And I did have a very low grade osteoporosis at that
Mm.
time. So he went through, the discussion like, okay, well, your insurance for sure, we're not even 50, it's not going to cover the FDA approved prescribed medications, biphosphonates and all that stuff. Plus, he really didn't think that those were very strong medications in a way that they would help people. And so I kind of had to search out different options
For
at that
yourself.
point
Yeah.
for myself. And I found a primary doctor who was a direct primary care, who actually was very versed on hormonal replacement. And mind you, I actually also brought up to my OB, who I adore. She delivered three out of my four babies. I love her. I think she is an amazing. I asked her a few times if I needed to get my hormone levels, and she thought that it was not necessary because I was still having my periods.
Periods.
And so I just was really shocked. And so I seek out something for myself
Mm-hmm.
that I thought that it would be a good thing to get my hormones evaluated. And then, kind of the whole ball started rolling. I got an hormone replacement. My hormones were nowhere to be found. They
Oh,
definitely
wow.
bottomed out. Who knows how long?
They've been
You
just
know,
sitting, just disappeared.
exactly. They were just gone. And we don't know. From the labs, you can't really tell
Mm-hmm.
that how long that had been low, right? So then I also she was very good about coaching me with exercise program, heavy lifting, and
Mm-hmm.
also just high protein as a
Right.
nutritional. And these changes were really hard for me to do,
Mm.
really, really hard. I was also sleeping very little. It was a real big stress on my body. So I had to slowly make changes so
Mm-hmm.
that I can bring my body back to its full strength, right?
Absolutely.
So this actually helped me tremendously to actually realize the of lack of care. Basically, I was very fortunate to find her, but I also know that she is one of a kind, and it is
Mm-hmm.
really difficult to find good providers who are versed on these topics. And so this is
Absolutely.
why I'm so glad you're doing your podcast. And this is
Yeah.
why I'm so glad that you are doing your wellness care, just because we are not enough of providers for all the millions of women who
Yes.
actually out there and seeking care.
Oh, thank you so much. Thank you so much, Dr. Sarolta. When people think about even like menopause and perimenopause, and they think about that in its entirety, a lot, like you have mentioned, given us this beautiful history that, 200 years ago, a lot of people weren't thinking about it because a lot of women never made it that far. So 200
Exactly.
years ago, our lifespan was in the 30s. 100 years ago, here in the US, the lifespan did improve a lot, but there were still not everyone was really making it towards this menopause and perimenopause phase. So when we are now having women who are describing all these feelings or these sensations, which medically are these symptoms, we at times never saw it as symptoms. I remember not realizing that someone's coming in and just like, I just don't feel well, and fanning themselves, flaming and just off, and just thinking like, what is wrong with this person? But then I also
Right.
remember
That
that I was 29 and this person was in her 50s, and so she is trying to describe something that, words are failing her, and there's a medical term to describe whatever it is that she's having, and me as a medical doctor has not been trained to find out what's going on with her.
that's right. This is just
Yes.
not something that up until today, here we finally got the FDA black box warning
Oh,
off of it. But
yes.
it doesn't mean up until last year, most medical schools, I want to say about 99% of them, were
Hmm.
not teaching about menopause, how
Yes.
to manage menopause, and
Absolutely.
how to even, yeah, I mean, there's so many aspects of it, how to
Yes.
address it in a one-on-one conversation with our patients.
Yes,
Yeah,
absolutely. So there's so many facets when we think about this whole thing called menopause. And the enormity of this topic is that it affects every part of this woman's body. And prior to now, when we hear about menopause, the only thing everyone thought about was just hot flashes. And the biggest thing I should say was just like, oh, hot flashes, and that's it. Now we're knowing there's so many things, including how it affects our skin. So I really want to
Absolutely.
dive into now what you have mentioned, that there's a way for you to get the best results in your patients. And as much as we think that it starts on the surface, you're like, no, it really starts below the surface. So
100%.
yeah, so
100%.
tell us,
Yes.
what are some of the things that we need to keep in mind below the surface in order for us to get great results? And then we can move on to some of the surface things.
Yes. So just really briefly, because as
Yeah.
you know, we could talk about this for hours.
Yes.
So there is not enough time. But I do think, when I do my consultations, I will address and I will ask patients if they are on hormone replacement,
Mm.
because
Mm-hmm.
as we know, not even in menopause, but in perimenopause, the changes start to happen.
Mm-hmm.
And those changes include our muscles,
Mm-hmm.
include our bones. And guess what? Those are actually giving
It,
structure for our skin. So
yes.
when we're noticing those, hollowed in cheeks, when
Mm-hmm.
we are noticing that we have wrinkles,
Mm-hmm.
we have to address everything. So I do ask people if they are in on hormone replacement. Excuse me. I'm so sorry. There
Mm-hmm.
is a youngster. I will address this later. Thank you. Okay. So
Yes.
I want to know if they are exercising, if
Mm-hmm.
they are doing any weight training. I want to know because we want to maintain their bone and their muscle. If
Mm.
we are not doing that, my results, the expensive lasers people pay for, will
Mm-hmm.
not result in the same results
Right.
because simply they are not supporting my efforts.
Oh, wow.
Okay. So,
I don't think that we think about this deeply enough. One thing that just came to mind, Dr. Saralto, is that whenever we talk about muscles and bones and building structures for those who are in perimenopause, the majority of the time we're thinking about the extremities, right? People are thinking about their arms, their legs. They're not thinking about the fact that your face, you have bones, you have muscles. And so, like you said, these laser treatments that you're spending a lot of money for, you have not allowed the foundation to be at its best so that the treatment can give you the top results.
100%. And people even go to plastic surgeons to have facelifts and things like
Mhm.
that, but then they look so hollowed
Yeah.
because, they have lost volume that
Hmm.
actually filled the space, including muscle or fat. And
Hmm.
so this is why actually nowadays when people get on GLP-1s, and
Hmm.
I'm a big supporter if it's helping their metabolism, but
Right.
we have to keep in mind that it is even more important for them
Mhm.
to eat high protein diet because that you have to support your muscle and bone. Otherwise, you're going to look hollowed out and you're going to look old.
Right.
So I think, these conversations need to be out there. So I talk about the hormones, I talk about exercise, I talk about sleep. Because if somebody doesn't sleep, then,
Hmm.
their internal cortisol levels are up, and that will not allow collagen building. That is not going to allow. So it will actually, the dullness of the skin, I cannot change. So
Mm.
it has to be a full package to be able to get the best result. And
Wow.
so this is this in the past, when
Hmm.
I started practicing medicine, and we did a lot of aesthetic treatments without consulting about this. So often people would come back and their results were subpar, and we didn't understand. Okay, well,
Hmm.
I did the same good treatment as I did someone else. But why is this person responding so beautifully and
Hmm.
this other person is just very, it's a very slight difference, not much. So these conversations need to be have. And then of course there are other things so we can do topically, people can do at home
Hmm.
besides their lifestyle, and then we can do things in the office to boost their home efforts to
Right.
to make their skin look healthy and yeah, and their body well.
Oh, wow. Okay. So now I know every woman who is out there in this perimenopause, menopause phase, they're hearing, oh, we can do things at home. Please, let us
We
know
can.
what are some of the things that we can do at home to have our skin at its best? Yeah, tell us. I'm super excited. I have my pen right here and I have my notes. So I am taking notes. Go ahead.
Wonderful, wonderful. So just like we talked about hormones for the body,
Mm-hmm.
just like for internally, it's really important. Or we use estrogen in a vaginal area for genitourinary syndrome of
Mm-hmm.
menopause. We know that estrogen is critical for the
Mm,
skin.
yeah.
Based on recent studies, about we lose about 30% of all of our collagen in the skin in peri
Oh my gosh, that's one third. A third of,
one third
oh my gosh.
before we hit menopause. So not
Wow.
even you don't even know most women not necessarily having hot flashes or anything like that. Some people
Mm-hmm.
don't, and you're it's like gone.
Mm.
So I think it's really important. Now there are other studies showing that most of our collagen, if we don't do anything,
Mm-hmm.
nothing, right around early 60s, we are pretty much gone with our collagen that we developed in our youth.
So by
So
60, oh my God. Okay, so that's kind of like when you're in the 40s, you're one third done. Like you've lost one third of it. And then
yeah,
by 60, you have lost it,
most of it is what you have is just the
like
skin outside,
leftovers.
you know. Yeah, exactly. It's not healthy. It's not.
Wow.
And then you have this is natural aging.
Absolutely.
Then we have photo aging. So when you live in Colorado like I do, high
Mm-hmm.
altitude will break it down even further. So I think it really will accelerate. We call it an accelerated aging.
Oh,
So
wow.
I think it's really good to keep in mind. So even though we don't know when we enter into perimenopause, but I
Mm-hmm.
think it's safe to say, based on studies, that right around 2025, our body stops making collagen spontaneously. So meaning that the gene we
Mm-hmm.
put the body stops a stopper on it. The gene we can stimulate the gene, so we can
Right.
remove the stopper, but why on its own, as we just go through life, age 25, it's no longer making you whatever we have, we have.
Oh,
Okay,
wow.
from there on, so it is really good to start. And there is a big trend for this. It's called the prejuvenation.
Mm-hmm.
Basically, these are the young individuals. Like you're talking about 25, 30, 35-year-old people, they don't even have a wrinkle on their skin.
Yes.
They should start. And we say, when you're done with babies, get on your retin-A. So retin is our traditional core collagen stimulator. We know
Mm-hmm.
it's good for many things. It thickens the skin. There are newer ones. I'm going to
Mm-hmm.
talk about it just in a minute, but that's our traditional.
This episode is brought to you by Truly Balanced Wellness Care. Most high level women are told that their labs are normal while they're struggling to lead through brain fog and fatigue. At Truly Balanced, we don't settle for not sick. We architect for peak performance. Whether you need a 30-minute hormone strategy session to audit your labs or are ready for our 3-month Jumpstart Intensive, we provide the physician led roadmap to get you back to your best. Visit the link in the show notes or go to www.trulybalancedwc.com to secure your spot. Now, back to the conversation.
It's really good. So I still am a big supporter. If someone is done with carrying babies and they know they're no longer going to get pregnant, get on it, use it every day, every other day, every third day, whatever your skin can tolerate. Because
Mhm.
it is some people can't tolerate it. So I just say even if you use it a little bit, it will give you a benefit. Then you of course you must use sunscreen to protect your skin from accelerated aging. So
Ah,
these are the two real basics that we've been preaching about, but
mhm.
there are newer kids on the block. So there are newer kids, and it's exciting. You know,
Yes.
research is always just fascinating. So estrogen, estriol, actually topical estriol now is available on the market in
Yes.
different formulations. And we know that using it on the face, it's very safe. It's not going to bump your internal estrogen. So it's not a if someone is on a systemic estrogen therapy.
Hmm.
And it will not irritate the skin. So it is really easy to use once a day, every other day. Again, just see how people can fit it into their schedule, but
Yes.
it will make a huge difference.
Wow.
So I love topical estrogen. Now, then there are individuals who kind of like a little bit leery about using estrogen or estriol on the skin. Then there are actually plant based estrogen like, but non hormonal products. They
Hmm.
call them adaptogens,
Hmm.
basically tiny molecules that help the skin to adjust, to adapt to stress and
Ah.
restore homeostasis in the skin. So these are actually some herbal products like ashwagandha, rhodiola, some mushroom extracts. So these are now in topical products actually can also stimulate and
Hmm.
mimic estrogen effect, but they are non hormonal. Some of them are really nicely pair up to a hormonal based stimulators. So those ones are one of my favorites is from a company called Skin Better Science, and
Yes.
yes, and they have a very Mistral Revive Renewal Serum. It is really good, and the research is very solid. So if someone wanted to go into the adaptogens, I kind of like to use different products, and this is one of them that I like to use. I use
Hmm.
Retin-A a few times a week. I'm one
Hmm.
of those people can't tolerate it, and then I like to use the topical estriol as well. I figure that I'm gonna try my best.
Yes.
Besides my systemic hormone replacement to help my skin.
Oh, I love it. So right now we've just really discussed that. We've talked about how, you're starting from the inside out with the muscles, bones, keeping all of that, making sure your protein intake as well, making sure that you're exercising so that you have the structure that's there to support the skin on the outer part for in us to have proper skincare during this menopause and perimenopause phase. And then now on the topical portion, we talk about some of the basics. It's been around forever, retin-A, using that and not just waiting until we are in that, the true perimenopause and menopause phase, that there's ways for those who are listening to this who are in their 20s, you've completed having your kids, and that's the most important part of this portion of the treatment is listening. If you have finished having your family, you're no longer planning to have any more kids, and you are in like your late 20s, early 30s, this is a good time for you to start before the wrinkles appear, especially keeping in mind that by the time we hit 40, we're one third finished with our collagen. And by the time we hit 60, like we're done. Like, and the body, she cut off at 25. She's like, thank you so much. I'm not producing anymore. So, I'm shutting down the factory. So these are ways for you to stimulate and have your skin staying revived. And then also one of the things that you mentioned too is the photo agent, which is something that we don't think about. I mean, we keep hearing like, make sure you wear your sunblock, but the photo aging that occurs, and that part, I think once you get to a certain level, it just like accelerates, right? All this photo aging, it's
Yeah.
like slow, slow, and then bam, here I am.
Bam.
Yes.
Yes. Then people say, "Oh, I have not been in the sun for the past 5 years." I mean, I know, but what I see on the skin is from your teens, your 20s, and and people think that they're just forever young and it will not affect the skin, but it actually does. It really
Wow.
does.
So protecting with the sunscreen. And then now some of the topical things that's been there. Oh, hi, we have Ron that's checking in from Dubai. Thank you so much, Ron. So some of the topical things we said that we have, the hormonal, the estradiol, which is definitely now you're seeing it there, and it has a beautiful, like you said, plump, and it keeps the skin looking nice and rich and really looking beautiful. But then we also are aware that there's some women who are a little bit leery of using hormonal
Yeah.
treatment, and you have the estrogens, which you mentioned, which they are they act a little bit like the estradiol, but they're non-hormonal. They're made from other plant-based things, and
Yes.
then they adapt to OJ.
Adapt. Yes,
Yes.
exactly.
Love it, love
Exactly.
it, love it. So, what
Yeah.
are some other things? So now someone has, gone through and they're deep in this menopause, and they're like, oh my gosh, had I known, oh my gosh, Dr. Sarolta, had I known. Now I'm like so deep into wrinkles. My face has dropped. I don't like what I'm seeing. And we know, I want to preface this by saying we're all beautiful, but we know at times we don't feel the way that we did on the outside. We don't feel that way on the
Yeah.
inside. And, as a woman, you do have the right to choose to enhance what's going on. What are some things that they can do that is nice and safe and has shown results?
Yeah, so I think that, even in the aesthetic industry, we have come a long way.
Yes.
People used to look sometimes hideous with what they wanted to do or what was available and what the industry could offer. But
Hmm.
I think that, the nice thing is that it really what we are trying to do now with our treatment is bring the beauty, bring the original beauty back to
Yes.
life.
Yes.
And so, therefore, treatments that are aiming, just like the topical is aiming to increase collagen production, elastin production, hyaluronic acid production by our beautiful fibroblasts in the dermis. So, basically, to stimulate our own body to
Yes.
repair.
Hmm.
And we know that the body is able to repair. We have the genetics for it, but
Hmm.
we have to bring the best out of it. And
Hmm.
so there are wonderful procedures for this that will actually bring out the best from our own body. So, for example, there is an injectable called
Hmm.
polyallactic acid, which is basically a biostimulatory injectable.
Hmm.
Initially when it came out, it was called a filler, but it really is not a filler. It will actually stimulate our own body to actually make new collagen and create more volume. So for
Ah,
people
so that's the one
with,
that's taken that, you know how we said at 25, the stop, it's like we put a stop on it. So that one lifts that stop so the production can
yes.
continue. Ah,
Yeah, it is absolutely wonderful. And it really will only create our own collagen. It will just
ah,
boost our body. So that's one way to boost it. Okay. So then there's microneedling or microneedling with radio frequency. When
mhm.
we create a microscopic trauma with a tiny itty bitty needle, it's kind of like mimicking a microscopic trauma that we could have gotten from anything else. So we know that when we injure ourselves, let's say we
Mhm.
have a paper cut, we have a cut during, in yard work or working in the garden or whatever, our body is able to fix it, right? So
Yes.
we know that all these different processes get stimulated in the body to make new collagen, to fix it, basically. So now we are creating a very clean
Mm.
environment, and we are going to stimulate the body with these tiny itty bitty needles to actually stimulate collagen. Now, it has to be in the right hands with the right settings.
Yes.
Because actually, this is something that microneedling with radio frequency or even just microneedling, if it is not used with the right depth or with right energy settings, it actually can break down fat, which we look at it like, oh, okay, well, that could be fun. But just remember, actually, if we are breaking down fat in our cheeks,
Yes.
that gives us a youthful look. Okay. And
Ah,
if we break it down,
then
then it actually
it
you
just
will
drops.
be volume depleted and you will
Mm,
look older. It needs to be used. So now we know that this modality is fantastic, but it needs to be used the right with the right energy settings, so we don't blast through and don't burn, don't dissolve fat. Now in some areas, if someone has some jowling or someone has a submental fat and we want to melt
hmm.
that fat, it's good for that, but
Yes.
it's not but it has to be again in the right hands with the right energy settings. But it is a fantastic way to again tighten the skin
Mm-hmm.
or stimulate collagen. And then probably the newest kid on the block is ultrasound stimulated collagen and elastin regeneration.
Yes.
Yeah, there are a couple of devices on the market. The one I like and I find it's a little bit safer. It's called Soft, which is 7 ultrasound transducers, parallel ultrasound waves will hit the dermis in 1.5 to 2 millimeter depth.
Mm-hmm.
And so it's very precise. I like that. It will heat. So the trauma that will the body wants to repair is that heat actually coagulate proteins, and
Ah,
then the body wants to repair and it will bring on the repair mechanism again, collagen stimulation, elastin, and then hyaluronic acid. So we kind of like we perk up our fibroblasts to start
just
working
to
again.
do all the things.
Yes, reorganize the dermis. Yes, exactly. So these are all different modalities that we can actually do in a very controlled setting to actually rejuvenate the skin. And there are other ways.
Yeah.
There are actually absorbable threads that we can put to restore, do reposition the skin, or again, there's a laser that can go underneath the skin to melt fat and stimulate collagen. So there are different ways to do it. It
Yeah.
always has to be in a very controlled way, so we don't do damage, but we
Absolutely.
stimulate it in a way that, again, we are basically reawakening our body. We regenerate
Mm-hmm.
what we used to have.
This is fascinating to see how far we have come, especially when we think about this journey with, the 200 years, the lifespan, the we have the lifespan, and then now to live a full life. Because there's one thing, as you mentioned, to be able to say now that, our lifespan is in the 80s, but you can have the
Yeah.
lifespan in the 80s, but not live a very quality life. And the
Yes.
quality of life not just starts from the inside, but it's also how you feel about yourself. And that's one of the things about this beautiful organ that is the largest of all, which is our skin. This beautiful
Yeah.
organ, to be able to have it, we honor of like all the protection that our skin provides, but then to know that we're able to help it in this phase, that we have ways that we can stimulate the collagen production. We have ways that we now know that, yes, we want to be able to use these mechanisms if you're using it on your face to help with the aesthetics, that we have certain frequencies that we need to be aware of, because if not, then we will melt the fat. And like you said, it's so important. Like, oh, well, I would love to melt this fat from my face, but if you don't realize that's one of the structure that's keeping that youthful look, you remove that and then everything lays flat, and now you're having the opposite effect of what you want. So beauty in this phase called menopause, I know it is subjective, but one of the things that I feel that happens with us women, we hear, and also what we get criticized about, a woman wants to go and to enhance so that she can feel as youthful on the outside as she feels on the
Inside.
inside.
Yes.
But she gets
Yes. So
criticized
true.
saying that we are just trying to look like you were 25 again. But if she feels very robust and energized and she sees these changes happening, and some of the changes she was not aware of what to do to prevent it, but now she's aware of it, and we have the technology that can safely improve when you're in the right hands, when you have the right care, when you have the person who's trained to do this, to safely improve her skincare. And keeping in mind her skincare, the skin is a barrier to the inside. So she knows that when she has great skincare, that's one of the first barrier of protection for a lot of things. So why shouldn't she be able to freely enhance and to do these positive changes that she wants without being criticized?
100%. And I think that when you actually, and there are studies on this, many, when you actually
Mhm.
feel good about yourself, the quality of your life improves
Abs-
tremendously. So I
Absolutely.
do think that our internal, how we are internally, it will reflect on our
Mhm.
skin, but we also want to support, because sometimes the skin kind of gets ahead of the game and
Yes.
shows all the wear and tear from our environment. And
Yes.
so to be able to have the capability to actually reverse that. So not just internally feeling good and strong and energetic and productive and live a happy life. It is perfectly fine to have, and it's not that we're trying to erase every single wrinkle, but I do think that when we actually feel good about ourselves in the mirror, that has a positive feedback
Oh, yeah.
towards our body.
Absolutely. Your mood
Yeah.
changes, your outlook changes, your energy level changes. And the thing is, like, when women are supported, we are such a huge backbone of society. When women feel when they are at their best and they feel at their best, they go out and produce tremendous change, positive change in this world. So it's important for us to support women, especially during this phase, because this is the phase of life where a lot of women can start to shrink because they start to cower back. They start to feel the phrase is, I don't feel like myself. And this is a phrase that's so common amongst women. And I'm pretty sure those who are listening to this, they're we have the honor of people listening to this from over like 12 different countries, from here all the way in Asia, that's listening to this podcast. And I'm pretty sure that I just don't feel like myself is a common phrase that we have. But
All
we
the
know
time.
that when we support women in this phase called menopause, even in the perimenopause phase, we keep these women in society, in the jobs. We keep the knowledge base there. The strength is there. Being able to pass on this information, like everything is there. We no longer pull away from society. We no longer start to have and create doubt within ourselves, create the doubt of the value that we provide for this society. And part of that is feeling and looking your best. So, with that, I want to thank you, Dr. Sarolta. Do you have any last words before we end this wonderful conversation?
Just one is start early. You may not have the signs that, okay, here it is, pause is coming.
Yes.
Start early. If you haven't started, just start where you are. You can start at any age.
Mhm.
It does not have to be at 35 or 40, but earlier you start, the better it is. So if you
Mhm.
heard this first time today, start today. Start with small steps.
Mhm.
We talked about a lot of information. It can be very overwhelming. And so maybe just start with one aspect of your environment, right? Start with high protein, more hydration, things like that. Start with small steps. Do it for a little bit, then add on. I think it can be incredibly overwhelming to hear a podcast with so much information and oh my gosh, I have to do now this, and this. And so I think that because you don't want to stress out, just start with one small step, do
Mhm.
it for a little bit, then build on. And that's environment. And then do one small step for your skin every day as well.
I love it. I love it. And that's great advice. You're right. It can be overwhelming. It can be overwhelming. And starting with a small step can get you from point A to point B, because once you take that step and it becomes part of your routine, then you no longer have to think about it. And then now you can add that next step. So that's such an important aspect. I know I hear Carla. Hi, Carla, you're so right. She says it's so very true that I don't feel like myself is something that she felt for 2 years. And so women, we love you. We support you. And that's one of the reasons why we have the Menopause Stories podcast. It is support us women. So we know that we're not going through this alone. You might feel like you're the only one. You might not have anyone else in your family that's discussing this. Maybe your friend circles are not discussing it. They're not discussing it because they themselves feel like they're the only ones. But I want you to know
Yes.
that menopause and perimenopause, once we get to this beautiful age, it's something that's 100% going to happen to us women. And so you have a community here that's here to support you through these different phases. And we will continue bringing you great information on how to navigate this portion of your life. And with that, we want to thank Dr. Sarolta for taking this wonderful time and sharing gems. For though this is definitely one of those episodes you're going to want to save, download, listen to over and over again, get your pen and paper. I took notes so you can take notes as well, and all the ways for you to protect your skin and to have it being at your best during this phase called perimenopause and menopause. And with that, we're going to end today's episode. We want to thank those of you guys who came on live and were listening. And we love, love, love that you are a part of our community. Thank you so much again. Bye-bye. You've been listening to the Menopause Stories podcast. If today's conversation hit home, don't let your story stay stuck in that midlife hijack. Head over to the show notes to book your strategy session and to join the movement of women redefining their power. I'm Dr. Tamara Beckford. Stay optimized, stay bold, and I'll catch you on the next episode.